Now, we'll examine the preparation of the 20th series molar with the perpendicular R alignment, specifically in the mode where the suction is grasped. We will begin by looking at the occlusal preparation of tooth number 26. The patient's head should be facing forward, and the operator's body is positioned at about the 8 o'clock position. To effectively utilize the vertical space at the 8 o'clock position in the perpendicular R alignment mode, it's essential to sufficiently push back the doctor's table. The patient's head faces forward, but tilts slightly to the left, helping the water flow toward the suction tip placed at the left corner of the mouth. The handpiece head is inserted in a perpendicular fashion to the plane formed by the oral orifice. When the handpiece head is positioned on the buccal aspect, the suction tip should be placed on the palatal side, as demonstrated. In the mode of preparation where the handpiece head is situated on the palatal aspect, the suction held in the left hand needs to be placed on the buccal side, thus necessitating seamless and organic coordination between both the left and right hands. Let's take a closer look. In this left photo, the handpiece head is positioned on the palatal aspect, with the suction tip approaching from the buccal side. In the right photo, the handpiece head is placed on the buccal, with the suction tip approaching from the palatal. In the left photograph, the third, fourth, and fifth fingers of the left hand, which are grasping the suction, are resting on the zygoma, whereas in the right photograph, the third finger of the left hand is deployed for supplemental support of the handpiece head. This is the main difference between the two. Therefore, the left hand's position focuses more on resting here, whereas the right hand's position primarily aims to secure stability by providing additional support to the handpiece. The point I want to make with this comparison slide is that the balance of various postures can be attained in diverse situations. Therefore, while a broad framework and structure are established, individual practitioners can apply their creativity to the specific details of elements, adapting to each situation. Let's look at the mesial and distal prep from the palatal and palatal lateral aspects. The left suction tip should preferably be bent inward. This is because the volume of space taken up by the suction is less likely to obstruct the movement of the handpiece head. With your right hand, grasp the handpiece with a long grip instead of a short one, and allow your fourth and fifth fingers to rest on the masseter muscle. Now, on this slide, the upper image shows the practitioner's position and orientation during an occlusal prep, and the lower image presents the practitioner's position and orientation during a palatal prep. The occlusal prep is represented by this yellow line. When performing a palatal prep in contrast to an occlusal prep, it is important to note that the doctor's position changes from the usual 8 o'clock to around 9:30. In the image above, this 8 o'clock position is advantageous for aligning the operator's line of sight perpendicular to the occlusal surface of tooth number 26. Conversely, the 9:30 position, as seen in the photo below, is more advantageous for aligning the practitioner's line of sight to be perpendicular to the tooth axis of number 26. This slide displays a picture that illustrates that when the suction tip is bending inward like the yellow line, the volume of the suction doesn't hinder the movement of the handpiece head. As you can observe here, the yellow line indicates a bending inward, whereas the red line denotes a bending outward of the suction tube, which affects the volume of the suction tube. This illustrates where the bulk of the tube will be situated. Thus, you can observe that the yellow tube causes less interference with the handpiece head's movement, whereas the red one significantly impedes its path. Alright, this slide illustrates the technique for the buccal, mesial, and distal prep of tooth number 26, approaching it with perpendicular R alignment. When prepping the buccal, mesial, and distal aspects, the perpendicular R mode is ineffective. If you mentally visualize the line of sight and the angle, you'll understand that the parallel or perpendicular L mode is much more appropriate. Therefore, I will move past this particular slide. Now, we will examine the methods for effectively hooking the suction within the perpendicular R alignment. Let's examine the components of the posture for placing the suction in perpendicular R mode, targeting the occlusal surface of tooth number 26. Since the suction is positioned on the right side, it is advisable for the patient's head to be rotated slightly towards the right. The operator should be positioned at 8:30, ensuring their line of sight is almost perpendicular to the occlusal surface of tooth number 26. In this specific situation, the bending of the suction tip, whether bending inward or bending outward, doesn't really have a significant impact. This is due to the fact that the direction of the suction's bend doesn't substantially influence the handpiece's positioning or your overall field of vision. It is worth noting that depending on whether you access the occlusal prep from the buccal or palatal aspect, you may adopt different auxiliary support positions for your left hand. In the left photo, the third finger of the left hand rests upon the tooth, and the first finger provides auxiliary support to the handpiece head. Meanwhile, the right hand obtains a rest from the masseter muscle. Observing the photo on the right, the fourth and fifth fingers of the left hand are braced on the zygoma, while the second finger of the left hand offers additional support to the right hand's handpiece. The right hand secures its rest on the mentum. Let's look at the prep for the palatal, mesial, and distal surfaces of tooth 26 from the palatal side. The patient's head has no rotation, but if you tilt it just slightly to the right, the water from the hooked suction tip on the right will drain on its own. It's the very same principle when you consider how water inside a shower enclosure flows into the drain all by itself, with only a very subtle floor inclination, not a very sharp one. The remaining postural elements are not significantly different from the prior ones. Alright, from this slide, you can readily see that there are several varied postures available for providing auxiliary support to the handpiece. The fourth and fifth fingers on the left get their rest from the zygoma, and the second and third fingers get a hard tissue rest on the premolar area. Building on that support, the first finger then lends additional stability by buttressing the handpiece's extended grip portion, which significantly enhances its overall steadiness and control. Now, let's examine the different ways to grasp the suction tip during perpendicular alignment. Let's check the occlusal prep of number 26. The patient's head is rotated slightly left. The operator's body is positioned at 3 o'clock, aligned perpendicularly with the tooth axis of tooth number 26. For all perpendicular L alignments, you should extend the handpiece line far enough in advance so it won't get caught or obstruct your work later. And it is also wise not to adjust your posture to the chair pedal, but rather to first set your posture completely, and then adjust the chair pedal to align with that posture. Left hand, fingers 4 and 5 on zygoma for rest, grasp suction tip. The aim is to use the suction tip in the left hand to slightly retract the left corner of the mouth to secure a clear line of sight. With your right hand, utilize your fourth finger to establish a rest on the anterior hard tissue. The entry angle of the handpiece should be perpendicular to the plane of the oral orifice to ensure that the handpiece's connected line does not make contact with the patient's head. Let's examine the prep of number 26 buccal, mesial, and distal aspects. The posture for this is almost identical to when you prep the occlusal surface. The sole distinction lies in whether you position the handpiece burr parallel to the occlusal surface of number 26 or parallel to the tooth axis of number 26. The image above displays the handpiece grip and angle for preparing the occlusal surface, while the image below illustrates the grip and angle for preparing the buccal surface. However, you can observe that the grip and the entry angle of the handpiece will vary depending on whether the handpiece burr is positioned parallel to the occlusal surface of tooth number 26, or if it's positioned parallel to the tooth's axis. When preparing the buccal surface, you'll place your right hand at a higher level compared to when you're preparing the occlusal surface. This action often results in your shoulder raising and your arm extending outward. Let's proceed to the next slide to see an illustration of this. In this scenario, the right shoulder is elevated upwards, and the right upper arm, extends outward relative to the torso. What would be the optimal solution for this? We simply need to apply the fundamental principles that we've consistently emphasized and reiterated throughout this process. The solution lies in appropriately modifying the higher level elements of your posture. By slightly raising the operator's stool or lowering the patient's chair so that the operator's torso is positioned higher relative to the patient's head, the issue of the right shoulder being elevated can be resolved. If you move the operator's torso from the original 3 o'clock position to 2 or 1 o'clock, the flaring of the right upper arm will be resolved. By adjusting your posture at these higher levels, your body position will actually shift to resemble the illustration shown below. This particular illustration, in fact, more closely represents the parallel mode. As you can see, each target area on a tooth has a more suitable posture mode, so instead of adhering to a single specific alignment, it is better to freely select the appropriate one for each situation. Now, let's look at the category of hooking the suction in perpendicular L alignment, instead of grasping it. We'll examine the prep on the buccal aspect of tooth 26. Besides holding a mirror instead of the suction, there isn't much difference from the grasping mode. Using a thinner mirror for retraction takes significantly less effort, and is more effective for ensuring a clear view compared to a suction tip. As you can see here, where you place the foot pedal significantly changes your body's balance. It is better to cultivate the habit of adapting the pedal to your body's balance, rather than trying to balance your body to the pedal's position. Let's observe the occlusal prep of tooth number 26. In this case as well, there's no major difference from the grasping mode, aside from holding the mirror handle instead of the suction. What's particularly noteworthy here is that we're currently performing an occlusal prep from the palatal aspect. In this situation, the patient's head should be rotated sufficiently to the left. This adjustment is crucial to prevent excessive wrist bending, allowing you to achieve the correct entry angle for the handpiece without strain. So in this particular situation, because the wrist is significantly bent, rotating the patient's head slightly further to the left will likely adjust the wrist's angle to a considerably more ergonomic position. As you can observe here, at this moment, we are performing an occlusal prep from the buccal aspect. The disadvantage here is that the head of the handpiece obstructs the view of the target area. Therefore, in this specific case, there is no valid reason or justification to select a posture that performs an occlusal prep from the buccal aspect. We've covered assist-free dentistry for the 20 series molar area. Next, we'll examine the 40 series molar, located on the right side, contrasting with the 20 series on the left. Furthermore, it resides in the mandible, unlike the maxilla position of the 20s. By exploring these distinctions, we aim to provide comprehensive insights into proper posture. Thank you for listening.